Hello, everyone, and thanks for joining. My name is Monica Nandwani, and I'm a GI nurse practitioner in California. Today, we will be discussing the question, what are the main causes of irritable bowel syndrome, or IBS, and how does the disease progress over time? Irritable bowel syndrome, or IBS, is a chronic, often debilitating disorder of gut-brain interaction, or DGBI. IBS is characterized by chronic abdominal pain and alterations in bowel habits, whether that's diarrhea, constipation, or a combination of both. IBS is one of the most common GI conditions and reasons for gastroenterology referral, and the pathophysiology of IBS remains uncertain and is thought to result from an interaction of different factors, a few of which we will be discussing today, including gastrointestinal dysmotility, visceral hypersensitivity, post-infectious irritable bowel syndrome, intestinal inflammation, alterations in fecal microflora, bacterial overgrowth, food sensitivity, genetics, and psychosocial factors. Let's start with gastrointestinal dysmotility. While there's no single pattern of motor activity that defines irritable bowel syndrome, some patients may exhibit motor abnormalities in the GI tract, including increased frequency and irregularity of contractions and potentially abnormal transit times. For visceral hypersensitivity, patients with IBS may experience heightened sensitivity to stimuli. There have been studies that have demonstrated that patients may feel pain from balloon distension in the intestine at lower volumes compared to healthy individuals, again, suggesting hypersensitivity. For post-infectious irritable bowel syndrome, some patients may develop IBS following an episode of infectious enteritis. So oftentimes with these patients, they might recall going to a trip somewhere, developing sudden changes in their bowel habits, and history of acute diarrheal illness can precede the onset of their irritable bowel syndrome symptoms. Intestinal inflammation can also be a contributor, and in some IBS patients, intestinal mucosa has shown increased activation of both the innate and adaptive immune systems, indicating a potential inflammatory component. There's also emerging research that suggests that the fecal microbiota in IBS patients may differ perhaps from healthy controls. As for bacterial overgrowth, there's been conflicting data regarding the association between small intestinal bacterial overgrowth, or SIBO, and IBS, but it continues to remain an area of interest. And oftentimes, many of our patients with IBS may present with symptoms of bloating or abdominal distension. For food sensitivity, patients with IBS may report worsening of their symptoms after eating certain foods or perhaps perceive an intolerance to certain foods. It is important to keep in mind that a number of food intolerances can cause symptoms that mimic or perhaps aggravate IBS. Some such foods include dairy products with lactose, legumes such as beans, and perhaps cruciferous vegetables such as broccoli or cauliflower, as these foods may increase intestinal gas, contributing to symptoms. For genetics, there is evidence suggesting a genetic susceptibility to IBS, though this area continues to be under investigation. As far as psychosocial factors, including stress and anxiety, these may influence the expression and severity of irritable bowel syndrome symptoms, highlighting that mind-gut connection. Now, let's shift gears to the question about progression over time. Most individuals with IBS have chronic symptoms, meaning that their symptoms can persist over time. However, the severity and frequency of symptoms can vary widely among our patients. A systematic review that looked at patients and followed them up to 6 years showed that in about 30 to 50% of patients, their symptoms remain unchanged. In about 2 to 18%, their symptoms progressed, and in about 12 to 38%, they had improvement in their symptoms, or their symptoms improved over time. One thing to keep in mind is that the subtype of IBS can also change over time. In summary, IBS is a multifactorial disorder with a wide range of potential causes. It's important to understand these potential causes as it can help in managing the condition and help improve the quality of life of our patients with those with IBS. Thank you for tuning in, and for more information, please visit the GAP website or the GAP ASAP.